Hi, I'm Steve Garnett. I'm the clinical lead for urology at East Sussex Healthcare Trust, and we have a very exciting, busy urology department here. Not only do we run a EDGH general urology service, but we're also a regional centre of excellence for robotic surgery, and we have an extremely busy stone service doing the most percutaneous nephrolithotomies in the country. And we also have a very advanced reconstructive unit doing female urology and reconstructive male urology. So within the department we have 8 full-time consultants and 8 middle grade doctors, and then we have 3 CTs and 2 foundation doctors. As a department we cover both Hastings and Eastbourne, but all inpatient activity and operating is in Eastbourne, so it's only outpatients and diagnostic procedures that are done at Conquest. So the junior doctors aren't expected to go to Conquest very much other than to help with clinics from time to time. And obviously emergencies can come from both sites, but they're all admitted onto Eastbourne, which helps us streamline the service and make sure there's support there at all times. So the way we run the department is, because it's busy, we have a consultant of the week who is a dedicated consultant committed to ward care and emergencies every single day of the week. And alongside that we have a registrar of the week who, so those 2 doctors are constantly there to provide support and advice.
Hi there, I'm Ross Kenny. I'm the core surgical trainee year 1 in the urology department at the moment. And so a normal day in the life of a urology core trainee starts at 8 AM for the handover. We meet there for about 15 minutes and discuss all the new admissions that came in during the day before and overnight. After that meeting, we then divide the roles for the day. And so if there's enough people then on the ward, so if there's 2 or more people on the ward, then as the core trainee, I'm expected to go to theatre. There's normally at least 2 or sometimes 3 theatre lists running at any given time. And the consultants are very happy for juniors to come in and watch and learn how to do them. If I have to go to the wards, then on the wards it starts with a ward round of the urology assessment unit where the new patients come into, and then the remaining 24 ward patients and outliers that we have.
Hello, welcome to Helsham 4 ward, side by side with the urology assessment unit. This ward looks after acute urological admissions as well as post-operative urological patients who come in through a variety of reasons under a variety of different consultants, surgeon, urologists. Quite a mixture of patients, women as well as men. A lot of operations dealing with prostate surgery, renal stone surgery, urinary problems, bladder problems, cancers, growths and so forth. So a whole mixture of different kinds of patients we see here.
This is the main outpatient department where we do the urology clinics. That's area A, and normally we do the clinic in one of those rooms out there. And there's another area downstairs in the basement where we do clinic on Wednesdays.
There are opportunities to go to clinics. One clinic that is excellent to go to is the flexible cystoscopy clinic in UIS. So there's a department called the Urology Investigation Suite where they do a lot of flexible cystoscopies and inserting suprapubic catheters and difficult catheters with guide wires. The nurses there are very happy for junior trainees to go along, and after a few clinics whereby you've observed, then the registrars can start teaching you how to do flexible cystoscopies as well.
Hello, my name is Susan Crosby-Jones. I'm matron at the Urology Investigation Suite. We're a very busy outpatients area undertaking a wide range of diagnostic tests and therapeutic treatments. We see mostly outpatients, but we also support the wider urology team and undertake emergency inpatient procedures or diagnostic tests. We're a very dynamic team. We're supported by the urology nurse specialists, both for benign and cancer services. And there are loads of learning opportunities here for you, and we would love you to come and see us.
There's also opportunities outside of the ward. You're rostered to do at least 1 half day a week within the operating theatres, within clinics, within the urology investigation suite downstairs, and outpatient clinics as well, however your kind of interests take you. So usually the day ends between 4:30 and 5 o'clock, and on a daily basis on the acute assessment you might see 4 to 8 patients, and the ward work depends on what comes through the doors. So all in all, a mixed variety of jobs, great team around us, good registrars, good nurse practitioners, a good rotation so far.
So a normal day is rotated to be in 8 till 5, and then an on-call day is 8 until the handover at 8, which can take up to half an hour, so 8 till 8:30 is those shifts. The nighttime shifts are 8 until the following handover, 8 again till about 8:30 a.m. In an on-call during the day, it's very much the same shift up until 5 o'clock. You carry the on-call bleep, which A&E doctors refer to, but normally they refer to the registrar, who then informs you of patients that are coming in. And then between 5 and 8, you're the only doctor on the ward, so you're expected to deal with any problems that arise during that time and continue clerking new admissions. At night time, the registrar is not on site, so you're the only urology doctor, and so you do take more A&E referrals, which after a few weeks you should know what needs to be admitted and what generally isn't admitted. And any questions that you may have, you can always speak to the registrar, who's available on the phone at 24 hours a day.
When you're on call, you're expected to be on the urology assessment unit pretty much most of the day. Also between 5 o'clock and 8 p.m, where then you get handed over by the night staff. The night staff also do the same thing on UAU, but in that time you have to look after both UAU and ward patients, and that lasts until 8 a.m. in the morning. There's a kind of a uniqueness to this surgical rotation where there's a cross cover between ENT and orthopedics, which you may be expected to cover on occasions as well.
The hospital night rota is managed by the departmental administrator for urology. That post covers the hospital night rota, which is made up of 13 doctors. They are from urology, ENT and orthopedics. The rota is 1 in 13 on-call rota. So you have your day on-calls, your night shifts and then your weekend shifts. There are always 2 doctors on at nights and 2 doctors on at weekends. Leave requests need to go to the departmental administrator for urology, and that person will obviously authorise them provided they're within a 6 weeks notice. Study leave, annual leave.
We are a busy DGH, so there's a lot of activity going on, but there's a regular Thursday lunchtime teaching session that we expect all junior doctors to attend. There's an MDM every Wednesday which has teaching opportunities, and then we run a alternate monthly departmental teaching session, which is a whole afternoon dedicated to junior doctor teaching, and we alternate that with the clinical governance meeting, which also has a large teaching component, and we also expect the junior doctors to contribute and present at those meetings.
My name is Peter Rimington. I'm a consultant urologist at the Eastbourne District General Hospital. I am normally in charge of the robotic surgery. The robot's £1.5 million worth of equipment that's been working here for 2.5 years. It works 4 days a week. I would say that it generates a great deal of the enthusiasm for what we do here, making us special on the South Coast. It's an opportunity, because of the multi-cameras in the operating theatre, that the very junior doctors can come in and have a look at anatomy that they may never have seen it before. It's a great learning opportunity as to what surgery can offer to patients. If you're a middle grade registrar, of course it's something you all know about and would be interested to see. And if you're a senior registrar, well, it's an opportunity to get your hands on. There's training modules, there's a simulator, there's all sorts of things that you can do with it. And if you're very senior and that's what you want to do, of course you can learn how to use it.
During the on-calls, you get to learn about, you see a wide range of emergency urology presentations, which is useful going into any other specialty really, to know how to deal with those. And so that can be anything from stone disease to blocked catheters to hematuria and testicular problems as well. Other learning opportunities as well include theatre exposure. So normally there's a training list on Friday mornings whereby the more simple urology surgeries are managed by a consultant and a junior trainee that they then teach how to do those operations, including circumcisions, scrotal explorations, hydrocele repairs, things like that.
It really depends what you want to do. You can learn about ward work, you can learn about pre-operative care of patients who are going in for major surgery, you can learn about post-operative care, That kind of surgery is cutting edge. The care before and after has been refined, and there's a very exciting new program for the preparation, event and recovery after major surgery, which would stand you in good stead wherever you went to look after patients.
As surgical trainees, we sign up to something called ISCP, and on there's a learning curriculum for each speciality. So there's a urology learning curriculum that you need to tick off that you've seen and dealt with common urological conditions. There is lots of research and things going on, so at the start of the placement, speak to one of the fellows very quickly about projects that are ongoing at the moment to get involved from the start, and then there's every opportunity to get publications and presentations internationally. So a few colleagues have gone to Boston for the Congress, and then there's the World Congress in Vancouver. So there's lots of opportunities there to get your research presented.
I think these days there is a lot of opportunity for feedback for junior doctors, and there's a lot of assessment of how they're doing. But what I would like to stress is it's really important that if any juniors have concerns about their training, how it's going, or any opportunities, that they let us know as soon as possible and feedback either to myself or the department manager straight away if they have any concerns. And I think you'll find that we're very open and happy to be approached. We just like to know as soon as possible.
My experience has been good. It definitely is busy. There's normally just one core surgical trainee, and so the precedent is that if anyone gets to go to theatre, it's that core surgical trainee as opposed to the F2s. But it's always nice to be fair to your colleagues, and if they're interested in surgery as well, then try and give them some learning opportunities as well off of the ward. Normally, well, at any given time, there's a registrar of the week, and who's either a very experienced associate specialist level or one of the very nice trainee registrars that are here. Everyone's very friendly, and they're always able to be contacted.
So all in all, a great rotation. You get a lot of practical opportunities to do practical procedures like catheters and flexible sigmoidoscopies. You can get outpatient opportunities in general clinics and urology clinics, and also if you're inclined towards surgery, you can get a lot of practice within the operating theatres.
We're very cooperative, we're very friendly, we go out together, we look after our staff, we feel that we support our juniors to the hilt. If they have complaints and they bring them to us, we will shift heaven and earth to fix things, and I think we get it right virtually all of the time. So it would be brilliant to welcome people to come and work here and work in a happy, thriving and efficient department.
Yes, I have enjoyed the rotation. I've learnt a lot. As I say, I've learnt a lot about emergency urology, and I've got to go into theatre and progress my logbook in that regard. And it's a nice, friendly unit. So yes, I have enjoyed it very much.
We look forward to welcoming you to the urology department at ESHT. I think you'd find we're a very friendly, busy but supportive department, and we really hope you enjoy your time with us. Thanks.